The secret to places like Intermountain Healthcare is that they are designing into care the best possible science. And they have shown that it's possible to improve care, and by improving care, reduce the overall costs of care. We've seen huge differences in rates of cesarean section across the country. And the evidence is increasingly clear that the higher rates are not necessarily good for patients.
The national C-section rate today is running about 34%. Intermountain as a system is running at about 20%. Some hospitals in this country have C-section rates as high as 45%.
In the last 2 years of life for patients with serious illness at the University of California, Los Angeles, the average patient spends 29 days in the hospital, whereas those at Intermountain spend 16 days. How many physician visits do they have in the last 2 years of life? 92 at UCLA, 48 at Intermountain Healthcare. Startling difference, almost twofold differences. And patients at UCLA spend 3 times as many days in the intensive care unit. As a consequence, in the last 2 years of life, patients at Intermountain spend about $54,000, whereas the patients at UCLA spend about $98,000.
If the rest of the country delivered care to Medicare patients the way that we do here in Utah, the total cost of care would fall by about 34%, and we would not be in the midst of a national health care cost crisis.